It is possible to be physically alone and feel entirely at peace. It is also possible to stand in a crowded room and feel a deep, pervasive sense of disconnection. Solitude is an objective state, but loneliness is a subjective distress. A study tracking nearly 500,000 people has identified that this internal feeling of loneliness contributes to the physical degradation of heart valves. By understanding the biological mechanics involved, we can identify specific interventions to protect the heart. Specifically, we are looking at degenerative valvular heart disease, conditions like aortic stenosis and mitral regurgitation, where heart valves fail to pump blood effectively. For decades, these were treated as mechanical failures, unavoidable consequences of aging or genetics. The clinical progression of these conditions is severe. Delayed diagnosis leads to heart failure, the necessity of surgical valve replacement, or sudden death. This research suggests heart valve deterioration is a system influenced by overlooked psychosocial triggers. Data from 462,917 UK Biobank participants, tracked over 14 years, reveals high levels of subjective loneliness correlated with a 19% increased risk for degenerative valve disease. Within that, aortic stenosis risk rose 21% and mitral regurgitation 23%. The researchers found a sharp distinction between social isolation, the objective lack of contact, and loneliness, the emotional distress of feeling alone. Objective factors, like living alone or a lack of social activities, showed no significant association with valve disease. The primary drivers of risk were the specific internal feelings of feeling lonely and the inability to confide in someone close. This risk profile remains consistent across all genetic backgrounds. Even in patients with a high genetic predisposition for heart disease, loneliness adds a significant layer of additional risk. The heart is resilient to the physical absence of others, but it is vulnerable to the distress of emotional disconnection. Curious, how does a subjective emotion in the brain translate into the physical calcification of a heart valve? One direct pathway involves the HPA axis. Emotional distress triggers the body's sympathetic stress response, straining the cardiovascular system. Chronic activation causes oxidative stress and reduced oxytocin, chemically contributing to the rigid calcification of the valve tissue seen here. There is also a critical behavioral component. Loneliness changes how individuals interact with their own physical health. Up to 15% of the heart damage in lonely participants is mediated by lifestyle changes, specifically higher BMI, a poor sleep schedule, and chronic smoking. Loneliness impacts the heart through two channels. It directly stresses the tissue through hormonal shifts and indirectly removes the protective benefits of a healthy lifestyle. Loneliness is a modifiable risk factor. Because it increases risk regardless of an individual's genetic profile, addressing social well-being offers a practical way to lower a patient's overall risk. For those already diagnosed with heart valve disease, reducing loneliness can help delay the progression of the condition and postpone the need for surgical intervention. One actionable step is prioritizing relational depth. Because the inability to confide is a primary risk driver, having a single trusted confidant is more clinically significant than having a large, superficial social circle. There is also a physical shortcut to protection. Since a portion of the damage is mediated by lifestyle, individuals can intercept some of the harm by focusing on measurable health habits. Prioritizing sleep hygiene and weight management provides a physical buffer against the downstream effects of psychological stress. Subjective loneliness correlates with a 19 to 23% increase in valve disease risk, but establishing deep social connections and consistent physical habits can reduce this burden. Ultimately, alleviating social disconnection and maintaining healthy daily routines are absolutely essential components of comprehensive, long-term cardiovascular care.